Hey guys, Dr. Christy Ennis. Today we are going to be talking about knock knees, or genu valgum as the big professional term is called. All that really means is when those knees start to cave in, as opposed to going weak in the knees when your favorite hunk walks through the door. Now, the biggest, actually most important thing to know about this is even though you might feel it in the knees, right? You might feel some pain in through the knee itself. This is really not a problem with the knee, but it's a problem that either stems from the hip or from the foot. So with the hip, it's that femur, right? That big long bone coming in. And with the lower part of the leg, it's the tibia, right? That big bone in that lower leg that rolls in, causing this kind of thing in the knee. Now, generally speaking with the hip, there's usually some tightness and some weakness in some specific muscles, right? The weakness comes in the muscles that help pull that hip out, and vice versa. A lot of times there's tightness in those inner thigh muscles. With the foot, you could have a flat foot, and that automatically is going to make those legs turn in a little bit. Here's the trick though. You can actually have a foot that rolls in that isn't flat and is rolling in because those hips are a little bit weak and causing that to roll in. So if you hop out of bed in the morning and you have no arch in your foot, you can be pretty self-assured that you've got some flat feet. If you have a nice arch and it just collapses, then it actually is really important to start with the hip strengthening and stretching before you just throw an orthotic in that shoe. And we will talk about that after we talk about the hip. So, as I said, it is a weakness or a tightness very often. Also know that genetically, especially women, you can just be predisposed to kind of be in that position, but these things are still important. These exercises are still going to be important to do to help those muscle imbalances. So it's that outside muscle, or those glute medius and glute maximus muscles, that tend to be the weak muscles. So I'm going to slide on my other side. We're going to start with a progression of exercises that are kind of level one and get a little bit harder based on kind of where your strength is. So number one is the clamshell, one of my all-time favorites. So make sure you straighten out your legs, and when you look down at your feet, you can see your feet and your toes, but not much of your leg. Then you know you're kind of in a straight position. From there, bend those knees. Don't let those hips slide forward. Keep your feet together, and you're gonna lift just that top knee up. Don't rotate backwards, that's also important. And you should really feel that hip working there. All right, so again, this is kind of level one, step one. To make this one a little bit harder, if you lift up the bottom leg and then add that same motion in, this one's gonna feel it even more right in that same area. You can always add a band too if you wanna have a little bit of resistance to add to this. From there, keeping those knees bent, I'm actually going to come up on that forearm, making sure those legs don't slide forward. Keep them where they were. And we're going to go right into a little side plank. So now I'm using actually this bottom leg, right? Getting those muscles, those hip abductor muscles working, and some abs too, and some arms, can't go wrong there, right? So little dips are typically where I have people start. And this is great because you can modify this to make it harder or easier depending on where the leg is. So bent legs is a little easier. Obviously straight leg is gonna be a little bit harder, right? You got more to lift when your leg is straight. Now, going back to those bent knees, if we go up and then add that clam in, now you're getting both sides. So I'm gonna dip down as I lift, I'm gonna add that clam in. Oops, their legs too far forward. Lift and add that little bit of a clam, right? So that again, a little addition in there just to really get those muscles going. 10 to 15 reps for these as you progress, okay? And then two other strengthening ones are going to be standing up. I'm going to use a band for these, but again, if you're just starting, by all means, feel free not to use one. But I'm going to bring it above the knees. The higher up, the easier it is. The lower down, the harder it is. You want to make sure you keep those hips pointed and those feet pointing straight forward. You're going to take a little step to the side and together without doing the penguin, even though it looks kind of cool. You want to make sure everything is staying nice and steady, okay? A little bit harder for this one would be to step to the side and add a leg lift out. Again, without leaning, otherwise you're not really using these muscles. But now we're using both legs, again, both sides, a little bit harder. The last one is going to be coming down into a squat, and I You can squat lower than me if you can. For today, at this point in time while I'm making this video, this is all I got in me. So from here, and you can even hang on if you need to, you're gonna take and you're gonna pull those legs open. So now we're getting a little bit more rotation and obviously in a little bit more of a difficult exercise here as well. So 10 to 15 reps here too. I'll face this way just so you can see what it looks like. Again, if you can squat deeper than me, by all means, go ahead and do so, but I'm feeling that right in those bunsies, okay? I'm gonna take this band off and come right down onto the ground to get the muscles that tend to be a little bit tight. I'm actually gonna do a stretch and a release at the same time. You just get a little bit more bang for your buck when you do that. So if I look at my left hip and piriformis, I'm actually gonna cross my left ankle over. I'm gonna take the edge of the Derma Edge, and now I'm gonna add a little bit of active release here. So I'm not digging for dear life, just a little bit of pressure where those muscles tend to be tight. So usually I would start here, and then if it's comfortable, you can bring that opposite leg up and still get a little bit of a rocking motion. Again, to get that active release, which just helps to get that muscle going a little bit more. If that's too much for you, get rid of that. And you can even just take and bring this knee towards the opposite shoulder. Sometimes it's uncomfortable to bring the opposite leg up. And I tell people about 3 to 5 breaths worth as opposed to counting seconds. It helps you relax into it a little bit better. And then the last stretch, I'm gonna come back up to sitting. You can do this one with one leg out, or you can do both at the same time, right, to kind of get that adductor. I generally think it feels more comfortable to do it with one leg at a time. So again, in that inner thigh where those muscles tend to be tight, I'm gonna take, and yes, mine are, and I'm gonna gently push open and come up. Excuse me, gently push open and come up. If this is too much to do in this position, you certainly, again, can do this one lying down. Same concept. Usually I have people cross that ankle a little bit and then add that little bit of pressure as you open up. You can even put something underneath you, a pillow or a yoga block to help support you, either seated or lying down. So there you have it. That's your hip routine. Now we're gonna move on to the foot. All right, now that we've covered the hip, we're gonna move on to the foot. So again, if you actually do have a flat foot, right, where you don't have any arch, mine is actually not that way, but if you don't have an arch in that foot, that's where you wanna think about some orthotics. There are some decent over-the-counter ones, such as A-Line, and actually those are my favorite. I'll link that too. And even Super Feet. Sometimes you need to go a little bit more custom, but oftentimes you can get away with just one of those over-the-shelf. And like I said, A-Line actually is my favorite because it is a little bit customizable as well. And they're not even paying me to say this right now. So if you do not actually have flat feet, or even if you do have flat feet, what happens is that foot tends to roll in. And so you end up getting some significant tightness and yuckiness, there's the professional term again, yuckiness, on the outside of that leg and in through the calf and into the deep calf muscles. So the first thing we want to do is actually go over some releases for those muscles. All right, so to release the muscles on the outside of the leg, those perineal or fibular muscles, we're going to again just find that spot that might be a little bit tender. You might need to poke around a little bit. Light or medium pressure, find that spot, and then you're going to take that foot and kind of move it. You can actually play around a little bit with how it feels best to move. Usually for me, it feels better if I'm kind of bringing that foot down and in a little bit. Better meaning worse, meaning in other words, I feel it. And so you're doing this until it feels a little bit better. And you may have to do a couple spots there as well. To get the other part of that calf muscle, usually I go into the inside here. Same idea though, find that tender spot, press in with some moderate pressure, and then for me, for this one, it's usually an up and down motion of the foot to really get that muscle released. And same thing, do it until it feels a little bit better, and then you might need to move on to 1 or 2 different spots as well. All right, now we want to stretch those calf muscles, and you've got 2 of them, the gastroc and the soleus. So a lot of people will stretch the big gastroc muscle, but then kind of leave that poor little soleus behind. So we want to make sure we get both of them. So I'm going to use my left leg as a demonstration, going against the wall just for balance. You don't need to use your Hulk strength and knock it over, but that left leg will come back with the knee straight to start, and making sure that foot is straight. The front foot will go across just a touch so that we get the right angle for a stretch. And then you're leaning into that wall. Again, not trying to knock it over, just leaning in so that you feel a stretch through the back of the lower leg. You might feel it up higher towards the knee or even a little down lower towards the ankle or in the middle. Either way is totally okay. And about 3 to 5 breaths for that one. And then for the next one, to get the soleus, the muscle that lies underneath, we're actually going to bring that foot in just a little bit closer, because this time, again, keeping the heel down still, don't let that heel come up. You're going to bend that knee. And this one I usually feel a little bit closer to the ankle itself. And I just kind of want to stay here all day now, I feel like. But again, 3 to 5 breaths to get that lovely stretch going. And then we're going to move on to strengthening. Now we are moving on to the strengthening part, the last part of the video. So generally speaking, even though this gets a little bit overstretched, it tends to also be weak as well as that inside part. So we want to work on both of those things. So I've got a band looped around the ball of my feet. If you have a happy, willing friend, you can certainly use them to hold part of the band, but this tends to work pretty well. So to work on this muscle first, I'm using that left leg. I've got some resistance from the opposite foot, and I don't have great motion there, as you can tell. But we're going to pull that foot kind of down and out a little bit, really more of a neutral position and out, and around 10 or 15 reps, but do not make this painful. We're just trying to strengthen, not hurt. And then to get the other motion, I'm going to take that band off and actually hold it. And now I'm making sure the resistance is coming from the opposite side, and I'm going to pull in this time. Woo! Don't do that. So you want to be actually nice and controlled both on the way in and the way out, so that you're getting concentric where the muscle's shortening and eccentric where the muscle is lengthening and actually tends to be the weakest. So in other words, control in both directions, roughly 10 or 15 reps on each side. There you have a whole program, starting with the hip, working down to the foot, strength, release, and stretch to get all of that, bringing those knees apart a little bit. So thank you for tuning in today, and stay tuned for more. Thank you so much for watching today. If you would like to support me as well as reduce some pain and get rid of the appearance of that cellulite, click the link below to order your own Derma Edge, a device that I created and patented when I was going through the middle of Lyme disease in a lot of pain and needed a way to work on my own body. So the shape of the Derma Edge allows you to get all body parts in a gentle way. We're getting that fluid moving in between the layers, which helps you move better, helps get rid of that pain, and decreases that bumpiness of the cellulite. So make sure to click the link below to order your own.